How do bronchoscopy findings impact lung cancer treatment? Imagine being able to look inside the lungs without surgery. That's what a bronchoscopy allows doctors to do. This procedure uses a thin, flexible tube with a camera to examine the airways directly. In lung cancer cases, bronchoscopy plays a vital role in both diagnosing the disease and figuring out how far it has spread. It helps doctors gather the information needed to plan the best treatment for each patient. When a suspicious lung lesion appears on scans, bronchoscopy is often the first step to confirm if it is cancer. During the procedure, doctors can see the inside of the airways and take small tissue samples called biopsies. These samples are then analyzed in the lab to determine if cancer is present, what type it is, such as non-small cell or small cell lung cancer, and whether there are specific genetic mutations. This detailed information is crucial because different types of lung cancer respond differently to treatments like surgery, chemotherapy, radiation, or targeted therapies. For example, identifying genetic mutations can help determine if targeted drugs might be effective. Bronchoscopy also helps assess how advanced the cancer is. It can show whether the tumor has grown into nearby tissues or lymph nodes, which are small glands that help fight infection but can also be pathways for cancer spread. Knowing whether the cancer has reached these lymph nodes helps doctors decide if surgery is a good option or if other treatments like chemotherapy or immunotherapy are needed. Accurate staging is essential because early-stage cancers might be treated with surgery or targeted radiation, while more advanced cancers often requiring systemic treatments that affect the whole body. The findings from bronchoscopy directly influence treatment choices. If a tumor is blocking an airway, doctors might perform additional procedures during the same session, such as placing a stent or using laser therapy to open the airway and relieving breathing difficulties. If biopsies show that the cancer is localized and the patient is healthy enough, surgery might be considered to remove the tumor. Conversely, if the cancer is widespread or the patient's overall health is poor, less invasive treatments like chemotherapy or immunotherapy may be recommended instead. Recent advances in bronchoscopy technology have made the procedure even more helpful. Techniques like endobronchial ultrasound allow doctors to sample lymph nodes near the lungs more accurately. Robotic-assisted bronchoscopy and advanced imaging help reach small or hard-to-access nodules safely. These innovations lead to earlier detection and more precise staging, which can improve treatment outcomes. Bronchoscopy isn't just for diagnosis. It can also be therapeutic. If a tumor causes airway obstruction, bronchoscopy can be used to remove or shrink it, place stents to keep the airway open, or control bleeding. These interventions can significantly improve symptoms like shortness of breath or coughing and may even enable patients to tolerate other cancer treatments better. Studies show that when bronchoscopy successfully relieves airway blockage, patients often experience better quality of life and may live longer. Relieving symptoms can also make it possible for patients to undergo treatments they might not have tolerated before. However, it's important to remember that bronchoscopy has limitations. Not all lung cancers are accessible through this method, especially small or peripheral tumors. Sometimes additional biopsies or imaging tests are needed to get a complete picture. Every patient's situation is unique. Bronchoscopy findings are just one part of a comprehensive assessment that includes imaging, blood tests, and overall health. Treatment decisions should always involve a team of specialists who consider all these factors. If you or someone you know is facing lung cancer, discussing the results with healthcare providers is essential to understand the best personalized approach. In summary, bronchoscopy findings are central to diagnosing, staging, and sometimes treating lung cancer. They provide critical details that help tailor treatments, relieving symptoms, and potentially improve survival and quality of life. Thanks to ongoing technological advances, bronchoscopy is becoming safer and more accurate, making it an indispensable tool in modern lung cancer care. But remember, always consult medical professionals for personalized advice and treatment options.